Good afternoon, everyone. My priority is to keep workers safe all across Ontario. Our government is acting decisively and moving quickly to do just that. Yesterday, we hit another daily record with 370,000 vaccine appointments booked. And to date, over 2.8 million people have been vaccinated in Ontario. In the next 28 days, 40% of adults in Ontario will be vaccinated. This progress is keeping workers and their families safe. Many people can and are working from home. I applaud their patience and the patience of their employers in remaining home and reducing the spread of COVID-19. However, many workers, those on the front line, need to be on site to get their jobs done. First of all, thank you. Thank you to our grocery store clerks for ringing in the foods that feed all of our families. Thank you to our factory workers, like those at 3M, who are making the millions of masks that will keep all of us safe. And thank you to the pump attendant for operating the till at our local gas stations. You truly are Ontario's heroes. Second, our government is pulling out all the stops to keep you safe. Tomorrow, we're launching a series of workplace inspections, and we will have zero tolerance for those bad actors who flout COVID-19 safety requirements. Our inspectors will be focused on the hardest hit areas, starting with Peel and Halton regions, to inspect workplaces still open right now. Health and safety inspectors will visit food processors, factories, and warehouses. And they'll be checking up on the basics that should be commonplace by now, such as physical distancing, screening, and masking. At the same time, a multi-ministry team will be visiting big box stores and malls. Together, this means hundreds of workplaces and hotspots will be seeing us at their doors over the next few days. Let me be clear, if anyone violates COVID-19 safety requirements, we will take action. Individuals like managers and supervisors can be fined $750 on the spot, and corporations can be ticketed for even more. This no excuses approach isn't coming out of the blue. It follows months of education, outreach, and enforcement where required. We've conducted almost 20,000 inspections since January the 1st. We have helped businesses learn what they need. We provided detailed guidance for a wide swath of workplace sectors in multiple languages. And we've offered education on safety plans, screening methods, and how to figure out capacity limits. If businesses want to stay open, they must comply with the requirements we put in place for the safety of their workers, their families, and all of our communities. There are a few other sectors we're focusing on this month when it comes to workplace safety. We're further beefing up inspections on construction job sites to keep workers safe. And we're also continuing with our inspections of farms, especially those that employ temporary foreign workers. We're grateful for the work they do to keep us fed, and we need to make sure their conditions are safe. We're confident that these measures will help reduce the spread of this deadly virus and keep all of our workplaces safe for workers, for business owners, and for customers. I really can't stress enough, it is up to all of us to do the right thing. I believe in the people of Ontario and know that if we give this our all, there is light at the end of the tunnel. We will get through these next 4 weeks and come out stronger in May. Thank you, and please stay safe, everyone.
First question, please.
From Richard Southern at 680 News. Please go ahead.
Good afternoon. I'm wondering about the rules for big box stores where they're only allowed to sell essential items. I'm wondering if the inspectors will be policing that to make sure those correct aisles are cordoned off, Minister.
Well, certainly, as I announced, Richard, we are sending more than 100 inspectors this weekend into those hotspot regions, Halton and Peel. We've worked with local public health units to determine where we should be sending inspectors to. So we will be going into big box stores and malls, as well as factories, warehouses, distribution centers, to ensure that health and safety protocols are being followed. When it comes to big box stores, we've done literally thousands of visits since the beginning of COVID-19 there. We're particularly going to focus on masking protocols being followed, physical distancing, capacity limits. There will be other enforcement officers from local public health units and municipalities as well, but we will be ensuring that all of the rules are being followed.
Minister, we know where a lot of the infection is happening. It's in these manufacturing facilities, these processing facilities. I know you're saying you want them to follow the rules that you've laid out, but is there any thought being given to shutting down these facilities for a few days, kind of a circuit breaker, to get the infections under control? Because we know they're happening there in great numbers, Minister.
Well, certainly, and there's a lot of community spread happening. Look, my responsibility as Minister of Labour, Training and Skills Development is to ensure that workers are protected in those places that are open. We've done well over 45,000 inspections to date. We've shut down 78 workplaces that we deemed unsafe since the beginning of COVID-19, including 24 just since January the 1st. We won't hesitate to shut down any workplaces that are unsafe. And again, the inspections are one tool in the toolbox, but the vaccinations continue to be the answer. And I'm really excited to see that 370,000 people yesterday are registered to have their vaccination.
Next question from Sarah Mojtahedzadeh at Toronto Star. Please go ahead.
Hi, Minister. I was wondering if you could tell us a little bit about what your inspectors are finding in terms of what are the greatest workplace risks for COVID outbreaks, and how is this now playing into decisions about which workplaces and what kinds of workplaces will become potential vaccination sites in hotspot areas?
Yeah, really, really important question. First I want to say that overwhelmingly during COVID-19, businesses truly have stepped up. We really do want to target those ones that aren't playing by the rules and keeping their workers safe. As I said, we've shut down nearly 80 unsafe workplaces and job sites to date, but we still continue to see in some workplaces that masking protocols aren't being followed, safety plans aren't in place. Some workplaces still aren't pre-screening customers or workers that are coming in to ensure that they're free from COVID-19. So we continue to work with local public health to determine which workplaces to go into. And again, this is a huge number of inspectors going in over the next few days. We're literally going to do hundreds of factories, distribution centers, big box stores, and malls by Sunday. And we're moving as quickly as possible to ensure that we're reaching out to workplaces and to begin deploying resources to vaccinate those workers who have to work on a job site or in a workplace day to day.
Just a follow-up, if I can. I understand that last month the province offered Amazon 5,000 doses of the vaccine. The warehouse was an outbreak and shut down. And so I want to ask again, what kind of decisions are being made about which workplaces, based on the safety risks that your inspectors may be identifying, are getting priority in terms of workplace mobile vaccination clinics?
Well, when it comes to vaccine distribution, it's led through obviously through health. I can tell you from our ministry's perspective, we work, as I said, with local public health units to determine where there's some local issues and potential spread or spread actually happening in workplaces, and we target resources to those workplaces. I know we're moving quickly as a government to ensure that We set up mobile vaccination units. We've literally reached out as a government to hundreds of workplaces to determine where we're going to vaccinate workers, because it is critical that we vaccinate all of the people in Ontario. And when it comes to rapid testing, I know as of today, about 5.5 million rapid tests have been deployed to workplaces. We certainly pay close attention to all workplaces. One of the projects that our ministry undertook was rapid testing on construction sites, and we have about 150,000 rapid tests that have been deployed and taken in construction sites.
Next question.
From James Tarani at Caledon Enterprise. Please go ahead.
Hi, Minister. I'm just wondering, when it comes to paid sick days in the province, are you happy with the status quo right now?
Well, look, I'm proud that we negotiated a deal with the federal government. I mean, 300,000 workers in Ontario have either received paid sick days through the federal program or are about to receive paid sick days. I work really closely with Minister Qualtrough, the federal minister responsible for the program, and we've moved and worked closely with them to ensure that money gets into people's bank accounts, worker bank accounts, within 3 to 5 days. So there's been improvement, but I can tell you 300,000 workers have now applied or have received a benefit through the federal program. But I also want workers to know that one of the first actions we took as a government was to bring in a job-protected leave. If any worker is impacted by COVID-19, if you're in self-isolation, in quarantine, if you're a mom or a dad who has to stay home and look after a son or a daughter because of the school shutdowns and disruptions, you can't be fired for that. I also eliminated the need for sick notes. And furthermore, every worker should know that in that legislation, if you have to go and get a vaccination, your job is protected.
Follow-up?
So I mean, so do you think then enough is being done on this front when it comes to paid sick days?
Look, we're not going to duplicate the program. There's still about $700 million left in the bank account. Just over 300,000 workers in Ontario are receiving a benefit or have received a benefit. You can apply multiple times now. These checks are directly deposited into bank accounts within 3 to 5 days. We've made progress, but it's up to every elected official out there. Let workers know. Go to canada.ca/COVID-19. Paid sick days, 20 days are available to every worker in Ontario.
Next question.
From Laura Stone at the Globe and Mail. Please go ahead.
Hi there, Minister. I have some questions about the vaccination expansion announced yesterday as part of the changes. Your government said that hotspot postal codes in Peel and Toronto, adults 18 and over will now be eligible. There's very few details about how that's going to work. They said mobile units, essential workplaces, pop-up clinics at places of worship. When are we getting the details on that, and how exactly is it going to work?
Well, certainly the vaccination rollout is done through the Ministry of Health and the vaccination team. But I think this shows hope to people out there. 40% of adults in Ontario will be vaccinated in the next 28 days. That's good news. 370,000 registered yesterday. And it's really mission critical that we get out to these hotspot regions with the mobile vaccination units that you talked about, get into workplaces, places of worship, other hard-hit neighborhoods to vaccinate people. We are moving quickly to make this happen, and there'll be word coming very soon on this.
Follow-up.
As part of that, do you think essential workplaces should be the first targets of this initiative, or is it going to be broadened out to everyone? I guess I'm just wondering why your government didn't specifically target essential workers and workplaces as opposed to broadening it out to all postal codes in the hotspots at once?
Well, look, we obviously continue to monitor supply from the federal government, but we've moved quickly to expand the number of pharmacies, for example, that can get needles in arms. We're moving to mobile vaccination units in hard-hit areas. We've made phone calls to more than 500 workplaces now to begin looking at and doing vaccinations in workplaces. Again, it's all about getting into these hard-hit communities to ensure that we get needles in arms as quickly as possible.
Last question.
From Miranda Redekop at CBC News. Please go ahead.
Hi, Minister. There are so many outbreaks that we've heard of from places like manufacturing plants. You've now stepped up enforcement at various other times during this pandemic. What's going to be different this time, and do the rules need to be changed if people keep getting infected at their workplace?
Look, again, the majority of businesses have done a good job when it comes to preventing COVID-19 from entering workplaces, but we continue to focus in those regions, in those communities where there's infections in workplaces. That's why we're going into these distribution centers and factories and big box stores and malls where there's a lot of people under one roof to ensure that the rules are being followed. But let me be crystal clear, there is absolutely no more excuses at this point in the pandemic. Every single employer out there, every manager, every supervisor knows what they need to be doing. We put up hundreds of resources, videos, posters, tip sheets, guidelines in multiple languages at ontario.ca/COVID safety. And we're boosting the number of inspections. As I said, we've done over 45,000 to date, and we're really focusing in Peel in the Halton region over the next few days.
Follow-up?
For my follow-up, I wanted to go back to the questions about vaccinations in essential workplaces. There were so few details given yesterday. What are some of the essential workplaces where teams will be going for vaccinations? And could companies like cab companies and transit agencies be part of that?
Well, look, it's important that we vaccinate everyone in the province, every adult. Again, there's been challenges with supply, but as we get more supply, we continue to vaccinate more people, including those workers in those places where they're deemed essential and where they're going into a place of business or a place of work every single day. As I said, the rollout will be led through the Ministry of Health and the vaccination team, but I can tell you we're moving heaven and earth to ensure that we get those vaccinations out to workers and to all of the people in Ontario. We just need to continue getting that supply.
Thank you very much, everyone.
Thank you, everyone.